Thank you very much. That was quite long-winded, I'm sorry. I would first like to thank the scientific committee for inviting me to speak on this topic, and also my co-investigators. This was very much an opportunistic research project that I managed to complete. The concept of pod nursing. In recent years, we've seen a move away from open-planned ICUs to a much more pods of self-contained units within a larger ICU with lots of side rooms. And this has incorporated approach of team nursing as well as patient allocation. Certainly no local WA experience except from members who've travelled from interstate or overseas. And we've now got a new ICU that's just opened called Fiona Stanley Hospital, and that has taken the concept of pod nursing. It's a 40-bed unit divided into 10 bedded pods. There is a process that they call transitioning staff over to the new ICU, and we thought as a way for nurses to get an idea of what pod nursing is like, we would implement a 6-month trial within an open plan ICU. Like with any changes, you need to have some measures in place to monitor the change, whether positive or negative. And one aspect I chose was teamwork. We'd never really assessed certainly teamwork within the unit, but often, I'm sure you're aware, there's morale within a unit fluctuates. So the objective was to assess attitudes and behaviours towards teamwork before and after introduction of pod nursing. This is just a schematic illustration of the open plan ICU, divided in a surgical ICU and a general ICU. Very little barriers really between the two sides of the unit. Both of how the workforce is organised. We have 2 shift coordinators. One coordinates the surgical and the other general side of the unit. In Australia, for whatever reason, there's many terms to describe the float nurse or the access nurse. In WA, just to be different, we call them the admissions nurse and resource nurse for the general side of the unit. The areas coloured in the grey area are beds that are inside rooms. As you can see, the general side has a lot more side rooms, and that has lots of implications for covering, for breaks, etc. So the way that we divided the unit up into 4 pods, wherever possible, 5 or 6 beds within each of the pods. The change was that we would only have one shift coordinator that would oversee the whole of the 4 pods, and then there would be a pod leader that would supervise the nurses by each bed space. The roles and responsibilities were slightly different than the shift coordinator had been used to. Rather than having just responsibility of up to 12 bed spaces, they had an overview of the whole unit, less clinical involvement, much more of monitoring, negotiate, getting patients in and out of the unit, and promote an efficient working environment between the nurses, medical staff, and other members of the allied health team. The pod leader, again terminology, but that was a clinical nurse specialist or a senior registered nurse that would oversee that pod area of all those bedside nurses, supervise, teach and troubleshoot, and if necessarily take unplanned admissions. and to manage that within their pod. The way I assessed teamwork was that I located a nursing teamwork survey that had recently been validated in 2010 that had 33 questions and a 5-point Larkart response, and obtained permission to use it. I also used the initiative of having the opportunity to ask some free text comments, which can always be a bit risky. The results, just the demographic data. Before pod nursing, we have a nursing staff of around 140. It fluctuates between obviously sick leave and people on leave, etc. But before pod nursing, I managed to recruit 87 to complete the survey. After pod, 63. And I managed to be able to pair 31 of those completed surveys between a response before pod nursing and after. You can see the ages of the participants, and also a broad range of job or role responsibilities within ICU. The survey was divided into separate domains, and the first one was about trust, and that was looking at the ability of the team to accept constructive feedback. As you can see, the responses were very similar. I think the nurses were taking a middle-of-the-road approach, so it was usually 50 to 75% of the time in response to these questions. I looked at some of the free text comments, and you can see by reading them, the comments before nursing, highlighted in red, were mixed. And I'm sure you can recognise some of those sentiments. The next grouping was team leadership. The ability of the team leaders, the shift coordinator and the pod leaders to distribute the workload. As you can see, again, the median remained the same, although for question 2, the range did alter. It seemed that after pod nursing, maybe it was better able to monitor the change of workload that happened within that pod area. Again, some pre or before and after comments about pod nursing. Backup was another domain that looked at how well or willingness of staff members to work to help out within their pod. You can see in 21 there was a shift to a more positive response in the median. When the workload becomes extremely heavy, team members seem to pitch in and work together to get the work done. And perhaps that's related to being in a close team within a pod. You recognise when somebody is struggling a bit. Again, we look at the free text comments, pre and post. The shared mental models is the understanding of each team player or member of what their role is. And certainly there was a tendency within the pod to highlight the weaknesses and strengths of your pod team members. And again, some free text comments. The final was team orientation, the cooperation that occurred between the team members. And again, some free comments. So findings, basically, before and after pod, again, the nurses hedged their bets between 50 and 75%, so no extreme either way. Maybe pods encouraged because of the close proximity of your working colleagues into a definite team, encouraged nurses to work together. There were strengths and weaknesses, were possibly more identifiable within your team, and possibly the pod nursing encouraged nurses to become team players. I forgot to mention in one of the questions there was a shift when nurses tend to come back on time from their breaks when they knew that their colleagues depended within their pod, and then to be prompt in coming back from breaks. So limitations, certainly a single site study, a small sample size, and it was unequal survey responses before and after pod nursing. It wasn't truly an evaluation of pod nursing because it was an open ICU. Didn't involve other disciplines such as doctors. It was just focusing on nursing teamwork, and analysis was to some degree weak. So conclusion, middle of the road approach to attitudes and behaviours, not very bad, not very good. What helped to support teamwork was collegiate activity of the team leaders. If you had a positive team leader, that filtered through your team. Communication was important. Importance of being seen as a team player. As I say, coming back from break promptly, playing your part in the team. Sometimes bedside nurses' expectations, as some of the free text comments have shown, were a bit unrealistic. And certainly special consideration is needed to nurses working in side rooms. Thank you.